just went a little bit on the determinants of the oral health of athletes, but can you exactly explain how oral health is going to affect the performance of an athlete?
Yeah, so again, it's a really good question. It's very important to try and understand that. And some of the mechanisms, some of the ways it will affect performance are going to be very similar to the way we originally started this conversation. How could oral health affect people's life quality? And we talked about those psychological impacts. And certainly as part of our research activity, we don't just look at oral health, but we look at and we collect data on psychological impacts as well, and self-reported impacts on performance. So athletes, we find that there are negative impacts on confidence, on socialization, on relaxation, and on sleep. That's something that comes up very frequently in our research in elite athletes. We find aspects of those physical effects again, either severe pain or long-term but sort of low to moderate pain. And those are really important because those are kind of lower level but very frequent impacts from our research. There are also going to be the very catastrophic impacts. And again, I know, having talked to British rowing and many of the other Olympic teams, that each of the Olympic teams has experienced issues where an athlete has had an acute flare up, perhaps from a wisdom tooth or a dental abscess, which has been so bad that athlete has really been taken away from competing for an event. Now, those things happen, but they're much more infrequent. But they're obviously much bigger news when they do happen. What's also, I think, particularly interesting from the periodontal community, or for the periodontal community, is the aspects of raised inflammation and the microbiome. And I've had the joy of publishing a study recently with a group in Germany, and there we've identified a signal that inflammation from the mouth or gum inflammation can affect parameters measured on treadmill testing, commonly called VO2 max. It's a very commonly used measure. And we are also submitting for publication a study that we conducted in London, not on athletes, but on fit adults, also finding an association between the severity of gum health, or gum disease, I should say, and testing on a treadmill, as well as the maximum power achieved when jumping. So we're starting to see signs that not only do we have these kind of self-reported psychosocial impacts and pain impacts, but there may also be direct physiological and pathological impacts.